Hey everyone, how are you doing? I'm Wendy Myers of MyersDetox.com. Welcome to my channel all about detoxification. We're going to talk today about chronic fatigue syndrome, the top 5 things that cause chronic fatigue syndrome, and a couple of tips on how to address it and reverse it. You know, fatigue is something that so many people today are suffering from. It was one of my #1 complaints when I wasn't feeling well, and I've helped so many people recover from chronic fatigue syndrome. So I want to talk to you guys about how to address it and like what causes it also. So if you like this video, please click that link below here to subscribe and get notifications whenever I post a video. So appreciate that. I love what I'm doing. I love educating you guys about the underlying root causes of your health issues, AKA heavy metals and toxins and chemicals, and what to do about it, how to detox these things from your body. So let's get to it. So what is chronic fatigue syndrome? So it's a term used by a lot of healthcare practitioners when a patient experiences unexplained persistent fatigue for more than 6 months. Chronic fatigue syndrome is extremely common, although it's not as diagnosis like in many medical books, but it's a condition that responds extremely well to detoxification and balancing your minerals as well. So we don't need to use hormones, antidepressants, or any other drugs. I'm going to talk to you about some very, very simple things that you can do that are extremely effective to reverse chronic fatigue syndrome. So some symptoms. So as the name implies, the main symptom is unrelenting fatigue or exhaustion, and you want the presence of at least 4 of the following symptoms concurrently to get a diagnosis of chronic fatigue syndrome. So significant impairment in short-term memory or concentration, exhaustion lasting more than a day after exertion, sore throat, headaches, joint pain without redness or swelling, muscle pain, tender lymph nodes, and poor sleep. So a physical examination generally reveals only subtle abnormalities, maybe some lymph node tenderness or throat inflammation. Laboratory tests most likely will be normal. Physicians will frequently rule out other possible causes of fatigue, like, maybe low thyroid function or hormones or whatnot. And if nothing can be found, the patient will often be given this kind of a garbage can diagnosis of chronic fatigue syndrome by exclusion. So there's often some overlap with other conditions such as fibromyalgia or other pain syndromes, adrenal burnout, hypoglycemia or cravings for sweets, hypothyroidism, chronic or recurrent infections, depression or anxiety, and perhaps others. And what distinguishes chronic fatigue syndrome from some of these others is the long-term nature of the fatigue symptoms, the fatigue syndrome, usually in spite of a person trying various drugs or natural therapies. So the causes of chronic fatigue syndrome, in my experience, the causes are usually multiple. This means that one factor is not responsible for the condition. Instead, it's usually a variety of several factors occurring together, including any or all of the following. So toxic metals and toxic chemicals or heavy metals. These are always a factor in my experience, and removing 24 toxic metals and several hundred or more chemicals is always a priority when clients are doing my Myers Detox protocol. Really, really important. These can all be removed, all the different heavy metals and toxins with a Myers Detox protocol. A lot of these are described on my website on MyersDetox.com, all the different methods and protocols used on the Myers Detox protocol. And it's much safer and gentler than doing like IV chelation therapy or some of the things, kind of really harsh things that people do to detox their body. You want to do things that are safe, gentle, and effective. Nutritional depletion. This is always present as a cause of chronic fatigue, and the causes have to do with stress, impaired digestion, improper diets, or focusing on a raw food diet, which ironically you don't absorb as many minerals from that as you might think, or eating too many refined foods or the standard American diet. Most food today is not as nutritious as it was in the past, and if a person doesn't eat well or they're super stressed stressed for any reason, a big surprise in today's environments, everyone's stressed. When this is the case, digestion suffers and nutrient deficiencies and mineral deficiencies can easily develop. And also when people are being vegetarian or vegan, or they're fasting, or they're doing other really extreme diets, it can make the problem worse in many instances. I think some people can get by just fine on the vegetarian diet. I think the vegan diet, a lot tougher to get all the nutrients that you need, and then you don't get that cholesterol you need to make all of your hormones, your thyroid, sex, and stress hormones. So people start getting into trouble pretty quickly on a vegan diet. I was there myself. I was vegan for about 6 months, and I was a mess. I couldn't even think. I couldn't even string a few sentences together after only 6 months on the diet. So I don't know how people do it long term, but vegetarianism, people can get by on that, but not everybody. So I've done all of these things to work on my gut and was very lucky to completely recover from chronic fatigue syndrome. I was vegetarian for a while, and then I was vegan, and I've done fasting. I've done all kinds of different things that really were not right for my body. You have to find out what works for you. But as far as nutritional depletion, I think a lot of people have abused antibiotics, even natural antibiotics, taking too much of them. People have a lot of things working against that single cell lining of the gut. They have this lining of enterocytes. It takes a lot of energy that's very ATP dependent to hold together those very tight gut junctions. And if people don't have enough energy, they start getting holes in them. They start getting leaky gut. If people have eating a lot of non-organic food, they get all this glyphosate, which is an herbicide that will kill off their good gut bacteria, allowing opportunistic infections to take hold, too much bad gut bacteria, and that can erode that delicate kind of one cell lining of their intestinal lining. Just a lot of different things working against our gut. And then people get lots of chlorine in their shower water. Even if they're drinking filtered water, they'll be getting chlorine and other things that kill good gut bacteria. Smoking, too much sugar, so many things working against our gut bacteria. If you have poor balance of gut bacteria, then that can lead to impaired digestion and absorption of nutrients and even leaky gut. So many things working against our nutritional absorption today. And then there's adrenal exhaustion or other glandular imbalances. So these aren't always present, but typically they are. Our thyroid glands are very, very sensitive to chlorine, fluoride, and bromine. Those compete with iodine uptake in the thyroid. Your thyroid hormones are made of iodine. So if you don't supplement with iodine, or you ingest too many of these iodine competitors, big surprise, your thyroid's not going to work. That's why thyroid medication is the #1 prescribed medication in the US. And then adrenal exhaustion, if your thyroid is kaput, if you're super, super stressed all the time, long-term, eventually your cortisol and adrenaline output at your poor little adrenals that make those hormones just can't meet the demand. And then they start to go into failure and producing low amounts of cortisol and adrenaline. And then you go into what's called adrenal fatigue or adrenal exhaustion. A lot of medical doctors don't recognize that, but most people today doing cortisol tests are feeling exhausted. They have low cortisol, low aldosterone, low adrenaline, stress hormone production. And so often there's other autonomic nervous system imbalances that need gentle correction as well. I talk a lot about ways to correct your autonomic nervous system and get into that parasympathetic dominant part of your nervous system you need to relax and de-stress and detox and sleep. Then there's lifestyle imbalances. These are really, common aggravating causes of chronic fatigue syndrome. Among them are, lack of sleep, going to bed too late, financial or other worries, relationship stress, and bad attitudes like, playing the victim, extreme fears, depression, emotional trauma. I really truly believe that emotional trauma is at the root cause of any kind of physical or mental health symptom going on, depression, anxiety, etc. And any of these kind of symptoms can place so much stress on the body that they upset proper glandular and digestive functions, leading to the rest of the causes listed above that I just mentioned. And in most cases, these factors are really handled very easily once a person really understands the problem or the root cause of their chronic fatigue syndrome and they're willing to address it. It's like going to bed early, maybe working on some emotional trauma and realizing how much stress plays in the development of chronic fatigue syndrome. And then there's psychological and spiritual factors. When people have really intense fear or anger or even guilt or grief, that can predispose one to develop chronic fatigue syndrome. Chronic infections is a huge underlying root cause because, when your immune system is constantly fighting an infection or an opportunistic infection like Lyme or Lyme-like infections or anything else, that uses up a lot of energy. And in some cases, these chronic infections can be of primary importance, but typically they're just opportunistic infections that thrive because the body is too weak to fight them off. The immune system is fatigued. The immune system requires a lot of energy to function. So common viral infections include Epstein-Barr, hepatitis C, cytomegalovirus, hepatitis variant 6, and even HIV in some cases, fungal infections like Candida albicans and other fungal organisms. Bacterial infections in the teeth, gums, and gut and elsewhere are really common. Lyme disease, Lyme-like infections like Bartonella also can give rise to chronic fatigue syndrome, or just be in an opportunistic organism that makes things worse, but it may not be the underlying root cause of the problem. They just kind of showed up to the party. And then, other causes include poisoning with a pesticide or a medication or a recreational drug, or it can be the result of a really traumatic event that was kind of like the straw that broke the camel's back, like a surgery, an accident, a car accident, or a death of a loved one, or any kind of really emotionally traumatic event. Those can push someone that's maybe not so well to begin with over the edge and into chronic fatigue syndrome. So let's talk about how do you address this? How do you reverse and correct chronic fatigue syndrome? So over the past decade, I've worked with literally thousands of people to recover their full energy levels. And the methods that I use are kind of lined out in my Myers Detox protocol, where we detox heavy metals and chemicals. We work on clean up your environment. We work on sleep. We work on exercise, diet, lifestyle. I also use a bioenergetic protocol called NES Health, NES Health. And if you go on MyersDetox.com, you'll see in our programs tab, you'll see that in there. You can learn more about that. That's amazing at addressing emotional trauma and improving immune system functioning to kind of fight off chronic infections. And it also helps to kind of correct the digestive functioning and just help the body kind of regulate better, work more efficiently. It feeds energy to the body. Really, really cutting edge. I highly recommend anyone with chronic fatigue syndrome to look into frequency medicine or energy medicine or bioenergetics. They all mean the same thing. I urge you, if you've tried a lot of different things, you've tried the diets and the supplements and different programs and modalities and felt like nothing worked, you want to be trying detoxification of heavy metals and chemicals and bioenergetics. Those are the two key things that a lot of people are missing when they're trying to address the root cause of their chronic fatigue syndrome. You also got to look at, autonomic nervous system correction. This is another aspect of health and healing that's often overlooked or not even thought about by physicians working with chronic fatigue syndrome, because most people with this condition are just for a long period of time stuck in this sympathetic dominant mode where they're in fight or flight and they just can't turn off the stress hormones. They can't turn off the adrenaline, the cortisol, and they get this tired but kind of wired or exhausted feeling before they kind of sink into chronic fatigue syndrome finally. So I have a lot of different ways that I address that. Number one, taking minerals is really important. Magnesium. I use something called like a Modius health device that is a vagus nerve stimulator that will help you get into that kind of more relaxed parasympathetic mode of your node of your autonomic nervous system. Infrared saunas are great at getting into that parasympathetic state as well. And I mentioned bioenergetics. That's an amazing way to relax your body. Also, this pendant, it's called the Harmony Pendant. This is also a great way to reduce stress as well. We did a study with about 100 patients and we had a 700% improvement on average in people's equals heart rate variability, which is a measure of stress. So dramatic improvements there. It's super easy. Put it on, wear it, super easy. And you can track your own HRV if you have an Oura ring. You can track your HRV before and after putting on the Harmony pendant and see for yourself that it works. And so those are lots of different strategies there to work on sympathetic dominance or just a stressed out nervous system. Lots of different other things are great. Coffee enemas to work on your liver, to help clear your liver of toxins, help facilitate liver function and detoxing your body. Red light therapy. Red light therapy is great at charging up your mitochondria, getting out in the sun. Your mitochondria have biophotons, and so those biophotons absorb light from the sun. They absorb infrared light from the sun. You can also replicate that in an infrared sauna that uses the bulbs, like a Sonifix sauna. I love those types of saunas. The Sonifix is great. And so that's another great way to charge up your mitochondria, so to speak. And then I mentioned mental, emotional aspects, addressing emotional trauma. You can do that with Nest Health. You can do it with biofield tuning fork therapy. You can do it with sound therapy. Lots of different ways to just very simply transmute negative emotions and trauma out of your energy field. You know, negative emotions and traumas, they aren't in your brain cells. They don't reside anywhere physically in your body. There's been no research anywhere that has been able to find negative emotions or emotional traumas physically in the body. They reside in your energy field, and they can be transmuted and released very, very simply by using bioenergetic modalities and sound healing therapy. This is proven in the research. So that's just basically what exactly is chronic fatigue syndrome, giving you an idea of some causes, give you some idea of some ways that you can successfully address chronic fatigue syndrome. There's supplements you can take as well. I mean, there's heavy metals like arsenic, aluminum, tin, thallium, cesium, lead, mercury that are the primary culprits, heavy metal culprits in chronic fatigue syndrome, and you can take supplements to detox those as well. I talk a lot about that on my site on MyersDetox.com. You know, chronic fatigue syndrome is a multifaceted and common disorder that's kind of just growing in prevalence, and it has physical, mental, and emotional causes typically. So I hope you guys found this video really, really helpful. I dealt with chronic fatigue. It wasn't super severe, but I definitely dealt with fatigue for a really long time, and it was very, very frustrating. But I was able to turn my life around with detoxification and working on emotional trauma. And so I want to share this knowledge with you guys to help you address your underlying root causes that the mainstream medical establishment is missing because they're not looking at these very obvious things. So if you guys like this video, please click the link, the subscribe link below, click on that notifications button so you get notifications every time that I release a video. Thanks so much for tuning in. I'm Wendy Myers. Peace out. I'll talk to you guys very soon.